Okay, Calijah Cancey injured his pec major. Now, I'm sure you guys saw the video. It was kind of a nothing. He just kind of got pushed. But sometimes those are the ones that do it if someone is already prone to an injury. Remember, connected kinematics. That means that somewhere this tear could have been a symptom of something else. Now, when young, active, strong people tear tendons like that, you always have to think about, are there other reasons to make the tendons weaker? Now, maybe he was already suffering from an injury and working through it. Like, that's one of the things. Like, I don't know how many of you have actually sat down and talked to athletes, but you sit down and talk to athletes, they tell you they push through the pain. You know, especially the retired athletes, they'll open up a little bit more because they feel like, oh man, like for example, like with my startup Kancey, we sit down and talk with these athletes, and some of them are retired, and when they share with us that, oh man, 20 years ago, I wish we had this type of measurement tool, this type of kinematic evaluation, because I will push through the pain and suffered through it and got through it and did what I needed to. And I wish I could share this objective information about what was going on in my knee. So anyway, sidetrack. So let's just look at this pec major injury. What is the pectoralis major muscle? Now, you know, like when you look at a wonderful specimen like me with a massive pec, don't laugh. So the pec major is on the front. Now, what's this? Shoulder, right? Clavicle, humerus, shoulder, but what's missing in this? The chest, right? So the chest is missing. This belongs here, right? The chest wall is right here. That's where the neurovascular structures go, from the neck all the way down, okay? So the pec major comes from the front, the chest wall, comes all the way and attaches to the humerus. Now, here's we learned in anatomy, and it's a great way to remember when you're studying for anatomy, how and where where, different tendons sit. And the way we always understood it is the lady sits between the two majors. What are the two majors? Pec major, teres major, and the latissimus dorsi, the lat. The lady sits between the two majors. Great way of remembering it. Probably anyone in med school that did anatomy knows that, or anyone that studied anatomy knows that. So when you talk about the pec major, it comes and attaches to the humerus right on top of, and in fact, part of the reflection of the tendon overlies the long head of the biceps tendon. Then you have the latissimus, and then you have the teres major. Teres major actually comes from down here and wraps around to the front and onto the humerus. You have the subscapularis coming on the front. Up here, and this is actually the joint capsule, but it attaches to the lesser tuberosity. The pec major is actually coming like this. Pec minor attaches here to the coracoid and a little bit to the clavicle. So you have this. Then you have the pec major coming here, and that allows you to do this activity and this activity, okay? So that's why when you do curls, you do a little bit of bench press like this, you will engage your pec muscle. Now, the reason I want to talk about this, it's not a common injury to rip off your pectoralis major. Now, we don't know all the details. We don't know exactly how much of the tendon. Was it the more anterior or the posterior portion of the tendon? Was it the entire tendon? Was it complete disruption? Was it the pec major, the pec minor? Were there anything else associated with this? Is there an associated musculocutaneous nerve injury? Because when you rip things off, it can actually hurt other areas around that. And was this a symptom that he had tendonitis before? Had he injured the shoulder before? Because the actual episode or event where this happened wasn't a major like shove, fall, land on outstretched arm, or catching something like heavy. Like most of the times when I've seen it is someone falling and they grab a ladder and they rip it off. Or they have a traumatic injury, and instead of dislocating, they actually rupture their pec major tendon. So there's so many different mechanisms by which this could happen, and sometimes it may even go under-recognized. For example, people may say, yeah, it's sore here, and it's just a reflection of the pec major. It's not the entire tendon. And What can you do for this? Well, let's talk about it. Non-surgical, surgical, okay? Can you treat it with rehab? If it's a significant tear that it's disrupted, and we don't have any photos of the injury or imaging or anything like that, so we don't know all the details. But if it's a significant disruptor, and you can actually do a primary repair, and then you just put it back, and then you're talking about the 6 to 8, the 3 to 6 to 9 months of healing, depending on the phase of rehabilitation, biology of healing. Like, say, for example, there's something else going on. Maybe he has a medical disorder we don't know about that caused his tendons to be weak. And then that needs treatment, because if you don't treat the underlying metabolic medical cause, then it's not going to heal as well. Now, I'm not saying he's a smoker, but smokers are the ones that are prone to delayed healing and problems. And that's why oftentimes, if you've been a patient of mine and you are a smoker, you know that I recommend to stop smoking for a minimum period of time prior to the surgery and for at least the healing time afterwards. And it's a good way to stop. Like, 17 times worse healing due to the nicotine reducing the oxygen blood supply inside your muscle, bone, tendon healing structure. Imagine that. 17x. That's 1700%. Now, I'm quoting some papers, and I'm sure there's studies that have variations above and below that, but that's the one that sticks with patients. When they hear that, they're like, doc, I know, I gotta stop. Some patients don't care, and hey, doing surgery on a patient that doesn't work together with you, where they say, I'll take care of my diabetes or my infected toenail or my smoking habits and whatever before the surgery, because I want to have the best outcome. If you're going to have surgery, you're going to get cut under the knife, under anesthesia. You want to be at your best possible health, especially if it's a elective, non-urgent emergent surgery. Now, in this case, with a tendon disrupture, you want to get at it within a couple of weeks at the latest for a major tendon like that, or sooner. And so it may not be as elective, as it were, but it is important to know all the risk and benefit of surgery before you go in. Now, again, this isn't medical advice, this is education, and this is why we're here. And so when we learn more about the pec major tendon, we'll tell you more, we'll share it. This was breaking news. Back to you next week.